Right now, as you watch this, your body is making a decision every single second, without you even knowing. Imagine this. Every time you eat or drink, your food goes straight into your lungs instead of your stomach. Sound impossible? It is not. It almost happens to you thousands of times every day. And the only thing stopping it is one tiny flap of cartilage, your epiglottis, that you have never thought about. Until now. Look at this glass of water. Simple, clean, harmless. Now watch what happens when you take a sip. In slow motion. Something is happening inside your throat at lightning speed. This is the inside of your throat. Two separate paths, one for air, one for food. This is the epiglottis. A leaf-shaped piece of cartilage doing the most important job you never knew existed. Watch. It folds down in just 0.3 seconds. Seals your airway. Then opens. You never felt a thing. 0.3 seconds. Thousands of times daily. Every meal, every drink, every drop of saliva. Now imagine it is simply gone. That water droplet has nowhere safe to go. Your throat is one corridor, two doors. The epiglottis is the only thing choosing the right door. Look at this corridor. Two tunnels. Your trachea to the lungs, your esophagus to the stomach. Slow motion. Watch food travel through the pharynx. Epiglottis folds. Airway sealed. Food redirected. Done. Up close, elastic cartilage. Not bone. Not muscle. Flexible. Built to fold thousands of times without breaking. One more time. 0.3 seconds from upright to flat. The fastest movement your throat makes. Breathing. Epiglottis stands upright. Airway fully open. Calm. Unguarded. Waiting. Swallowing fires a whole sequence. Tongue, soft palate, larynx, epiglottis. All within 1 second. Together.
What is the epiglottis made of exactly? Bone, muscle, or something else?
Elastic cartilage. Flexible and springy. Unlike rigid hyaline cartilage. It folds and returns thousands of times daily without fatiguing. If it were bone, one meal could fracture it. Think of it as a biological trapdoor. Spring-loaded. It never misses. It never rests. At the base of your tongue. Here, the epiglottis attaches. This valley is the vallecula. Doctors examine it every airway assessment. Remove it. Gone. That open darkness is the entrance to your lungs. Nothing is protecting it now. Watch. Liquid enters. No trapdoor. Straight past the vocal cords. Down into the airway. Barium swallow. Trace the food path. White bolus. Dark throat. Epiglottis directing traffic every time. Pharynx. 3 zones. Top connects the nose. Middle connects the mouth. Epiglottis guard the bottom. The last checkpoint. The medical word. Aspiration. Something entered your airway that should not be there. Without the epiglottis, this happens every swallow. First response. The cough. Vocal cord snap, shut then burst open. Your emergency system fighting back.
What if a stroke patient has a blunted cough reflex? Do they still aspirate?
Yes, silently. Up to 70% of dysphagic stroke patients aspirate with no protective cough. That is why formal swallowing assessment is mandatory before any oral feeding resumes post-stroke. But here is the real danger. Your mouth is full of bacteria. Streptococcus, staphylococcus. Harmless up here, deadly down there. Those bacteria reach lung tissue. They multiply. Tissue inflames. Fluid fills the air sacs. Aspiration pneumonia. These are your alveoli. Air sacs thin as paper, wrapped in blood vessels. Oxygen passes directly into your blood here. Infected alveoli. Walls thickened. Sacs filling with fluid. Gas exchange blocked. If it spreads, life-threatening. Staphylococcus clusters. Completely normal in your mouth. Inside lung tissue, they need weeks of antibiotics to clear.
Which antibiotics do we reach for first in aspiration pneumonia?
Community-acquired. Amoxicillin, clavulanate, or a beta-lactam plus metronidazole for oral anaerobes. Hospital-acquired. Broader cover with piperacillin tazobactam plus vancomycin for gram-negatives and MRSA. Without an epiglottis, the coughing never stops. Every swallow is a threat. Eating becomes an ordeal. Some people live exactly like this. Patients whose larynx was removed due to cancer. Swallowing must be completely relearned. Therapists teach new angles, positions, and muscle movements to compensate for what the epiglottis once did automatically. In many cases, a feeding tube, food goes directly to the stomach. Eating a meal becomes a medical procedure. Aspiration pneumonia on a scan, dark healthy tissue, glowing infected region, fluid where air should flow freely. Even vocal cords try to help, snapping shut in slow motion. But they were never designed for this. Too slow, not complete. Tracheal entrance without protection, rings of cartilage descending into darkness. Open, always, to everything. The trachea is lined with cilia, millions of tiny hair-like structures. Your body's second line of defense. Slow motion. A particle falls past the vocal cords. The cilia react. They wave. Sometimes they succeed. Often they do not. Oral bacteria, traveling from mouth through unprotected trachea to lung tissue. In a healthy body, blocked before it starts. The lung responds. White blood cells rush in. Vessels dilate. Tissue swells. Inflammation. If too large, the immune system loses. Tracheal rings keep the airway open, but they cannot close. That was always the epiglottis's job. Now just a passive tube. Airways branch deeper, left and right, again and again, to those tiny alveoli. Every branch, a path aspirated material can travel. Cellular slow motion, alveolar fluid advancing, walls filling, gas exchange stopping. The body trying and failing to breathe. Most people think the epiglottis works alone. It does not. Swallowing is an orchestra. The epiglottis is a conductor. Watch the soft palate rise, closing the nasal passage. One instrument, rising on cue. Without the conductor, timing breaks. Pharyngeal constrictors squeeze top to bottom like a wave. Perfectly timed. Part of the system that depends on the epiglottis.
Which cranial nerves actually control the swallowing reflex?
Trigeminal CN5 for oral sensation. Glossopharyngeal CN9 triggers the reflex. Vagus CN10 for pharyngeal and laryngeal motor control, including the epiglottis. Hypoglossal CN12 for tongue movement. Damage CN10 and the epiglottis stops moving reliably. Airway emergency. Even with a healthy epiglottis, tiny amounts of material enter your airway daily. Your body calls it silent aspiration. Cilia, millions of them, waving in coordinated rhythm, sweeping particles upward, out of the airway, back to the throat. Watch this particle, carried upward on a river of mucus, the mucociliary escalator. Your body built this for exactly these moments. If particles pass the cilia, macrophages, white blood cells that patrol the alveoli and eat for material. Backup for the backup. Now the insight that changes everything. On the left, a primate, high larynx, separate breathing and food paths, choking nearly impossible. On the right, humans, larynx descended, longer vocal tract, complex speech made possible, but one dangerous shared corridor created. We gave up a safe airway to speak. Every language, every song, every conversation, made possible by that trade. The epiglottis is how evolution managed that trade. The guardian of the crossroads. The price of language, guarded every second. Your airway is a castle. Epiglottis, the outer wall. Behind it, the cough reflex, cilia, macrophages, each catching what the last missed. All commanded from the brainstem. Swallowing center, firing signals to every muscle. Perfectly timed. Thousands of times. Without your awareness. Complete swallow, 1% of real speed. Every structure moving. Tongue, soft palate, epiglottis, larynx. All before you can register it. Goblet cells lining the airways, producing the mucus layer cilia sweep. Remove one part of the system, and everything shifts. Macrophage engulfing a bacterium in extreme slow motion. Pseudopods extending, wrapping, destroying. Your immune system at the microscopic level. Baby larynx, position high. Babies breathe and feed simultaneously. As we grow, the larynx descends. The epiglottis becomes essential. Your body is doing things like this. Right now, heart beating, kidneys filtering, lungs exchanging gas. All silent, all automatic. Every organ, every tiny piece of cartilage has a job, and the only way to truly understand that job is to remove it. The epiglottis, small enough to hold on your fingertip, responsible for saving your life thousands of times before today.
If the epiglottis is surgically removed, can a patient ever swallow normally again?
Some can, with months of intensive rehabilitation. The supraglottic swallow technique, hold breath, swallow, then cough immediately, uses tongue base and remaining structures to compensate. Some patients manage pureed diets. Others need permanent feeding tubes. Outcome depends on extent of surgery and commitment to therapy. The next time you take a sip of water, you will feel it. That half-second movement in your throat, the epiglottis, working for you. If this video made you see your body differently, subscribe. Every week, we remove one more part. Every week, the body surprises us. This is your body. Billions of cells, hundreds of structures, working together right now, most unnoticed, until one is gone. Next week, we are going here. The retina. Inside your eye, a layer of tissue thinner than paper. 25 layers, creating everything you see. 5 million co-detecting cells, smaller than your thumbnail, sending signals to your brain 60 times every second, held there by nothing but pressure. The moment that pressure drops, this happens. The retina begins to peel, silently, painlessly. In many cases, the person does not know until it's too late. Next week, we remove the retina. This is where we're going next. The moment the retina begins to let go. See you then.